Hi, this is Elena here, and today I would like to discuss with you the Brusha improvisational model of metaphoric improvisation. Metaphoric improvisation was originally created by Shelley, Katsh and Merle-Fishman. According to Brusha, it was introduced at the 1984 Conference of the American Association for Music Therapy with the paper titled The Musical Metaphor, a Model for Music Therapy and Community Practice. The following year, Katsh and Merle-Fishman presented the paper titled Metaphoric Improvisation Therapy: Advanced Concepts in the Integration of Music and Psychotherapy at the Conference of the National Coalitions of Arts Therapy. Since then, Brusha has mentioned metaphoric improvisation in many of his publications, including Improvisational Models of Music Therapy, a textbook from 1987, and the article A Survey of Treatment Procedures in Improvisational Music Therapy from 1988. Improvisational Models of Music Therapy from 1987 is one of, if not the most well-known publications detailing this particular framework. Metaphoric improvisation is a combination between music therapy and psychotherapy that incorporates aspects of Gestalt therapy, transactional analysis, and developmental theory into its practice. The main components of this framework are a musical improvisation, where the improvisation is known as a metaphor for aspects of the client's life and life experiences, and a subsequent verbal discussion. Goal areas include increased awareness, spontaneity, and intimacy in relating to self and others. Metaphoric improvisation can be used in community with adults with neurotic tendencies or a history of psychiatric disorders, as well as stated by Brusha, well-adjusted adults who desire to work on aspects of their personality or the resolution of problems in their individual lives. There are a few prerequisites in metaphoric improvisation, including the ability of having expressive and receptive language skills, and a belief in therapy and a belief that the client is able to elicit their own change. With this being said, there is no musical experience required in metaphoric improvisation. Metaphoric improvisation is designed to focus on individual clients within a group setting. It originally involved the use of two music therapists working together, but now can be completed with either one music therapist and/or in individuals or couples sessions due to adaptations that have occurred. In metaphoric improvisation, there are 5 overall steps or work phases in a typical session. The first is warm-up, which involves a warm-up activity or exercise that allows the clients to introduce themselves and become acquainted with each other and the music therapist, as well as allowing the music therapist to introduce the rest of the session and what generally metaphoric improvisation is and involves. The next phase is identify a client issue and involves the music therapist working with one client individually to identify a particular issue that they would like assistance with. Methods for this include verbal discussion, guided fantasy, relaxed listening, and free improvisation. The next phase is that of experiment, which is or improvisation, where the client acts out the identified issue and potential resolutions for that issue. If necessary, the music therapist and other clients may join in the improvisation, with the music therapist filling in roles of significant others in the client's life. The fourth phase is that of consolidate. This phase involves the music therapist and client having a discussion about how the improvisation allowed the client to work through the identified issue and some particular resolutions for that issue. Commonly, it is in this step that clients are able to relate their respective issue to the respective issues of other clients and the experiences of other clients, creating a sense of group unity. In the final phase is close and involves the music therapist leading a verbal discussion and/or musical activity to close the session. Of these phases, it is the middle 3 that are repeated in a cycle for each individual client. This allows the clients to work on individually their own identified issue within the context of a group setting. In metaphoric improvisation, there are 3 main areas of interpersonal dynamics. The first is perceptual experiences, which allows clients to become aware of the figure-ground gestalt and temporal orientation of their perceptual experiencing, while focusing on what is referred to as the here and now, or the present moment. Next, clients are also able to work on developing the respective ego states, working through the parent and child states to allow the adult state to emerge independently. Finally, clients are also able to work on script beliefs, which are beliefs that clients establish about themselves and their life. These states are established in childhood and are worked through in treatment options such as metaphoric improvisation. In metaphoric improvisation, there are also three main areas of client music dynamics. The first is sound associations, which involves the clients being able to access inner realities and memories, as well as elaborating on experiences within their personal lives. Next is the aspect of musical metaphors, which occurs during the metaphoric improvisation, or musical improvisation, excuse me. The belief that the improvisation is a metaphor for the identified issue allows clients to reflect on the here and now and to represent experiences symbolically. Finally, metaphoric improvisation also allows the clients to gain a sense of musical nourishment, including the gratification of aesthetic and spiritual needs, as well as feelings of well-being and hope. In order to achieve positive client responses to treatment, there are many roles that a music therapist must fulfill in metaphoric improvisation, particularly. These roles include accepting the client, supporting the client, and guiding the client, as well as modeling awareness, spontaneity, and the capacity for intimacy, which are the three aforementioned goals. As well, the music therapist must also or can also represent significant others in improvisation, and this is completed through acceptance, support, and guidance as well. And finally, the music therapist should also focus on treating the whole client, and this is achieved through a balance of verbal and musical expression, as well as various other therapy techniques. In metaphoric improvisation, there is also a need for the client-therapist relationship to be equal, genuine, and non-directive. This relationship exists in what Brusher refers to as a prescribed treatment approach, and is established and maintained in a way that the client is willing to accept. This is because, in this framework, the client is in charge of their own change and growth. In this relationship, aspects of transference can also develop, meaning that a client may begin to relate to the therapist as they would a significant figure in their life. Transference in this form of relationship is worked through acknowledging it and shifting the client's focus to the here and now. Metaphoric improvisation is commonly used as a short-term intensive treatment option that assists the clients in developing the ability to independently resolve their own identified issues. The sequence of treatment includes increased awareness of incomplete gestalts impinging on the here and now, increased contact with aspects of self and others, and increased capacity for intimacy and spontaneity. Additionally, assessment, evaluation, and treatment are all overlapping procedures in this framework due to its typical short duration of usage. Main sources of data include the client's verbal reports, improvisations, and non-musical behaviors. There are also multiple areas of musical assessment in this framework, including musical flexibility, range of expression, correspondence between one's music-making movements and the musical outcome, relationship between client's music and the music of therapists or other clients, and changes in musical relationships with others, amongst other areas of musical assessment. With this being said, it is important to remember that verbal and musical data are of equal importance in this framework. Finally, I would like to briefly mention a sample goal and objective for a client who may benefit from metaphoric improvisation. In this instance, the hypothetical client is a 23-year-old woman who has been diagnosed with both generalized anxiety disorder and mild clinical depression. A sample goal that can be used in her treatment is for her to confidently navigate life experiences, with the corresponding objective being that she will make multiple decisions to create her individual musical metaphor each session for 3 consecutive sessions. Within a session, the client will be able to make decisions in regard to her identified personal issue, the sounds or instrumentation that she chooses for improvisation, who participates in the improvisation with her, whether it be just her herself, the music therapist, or the music therapist and other clients, and also how she chooses to engage in improvisation. This will likely assist her in being able to make decisions in her personal life, contributing to the ability to confidently navigate life experiences. And finally, here are my references. Thanks for listening.